So if you're thinking about doing an evaluation, one question I always ask people if they're sort of on the fence about doing an evaluation is, what do you hope to get out of it?
Hmm.
Because for some people, it's the documentation to get accommodations. For others, it's better understanding of their child or some combination. But a lot of it's also looking at what are you going to do with the information? Because, for example, with ADHD, if it's pretty clear cut that someone has ADHD, doesn't seem to be any concern of anxiety, depression, really anything else, well, obviously you want to be very thorough in figuring out what's going on. But certainly there could be cases where you may not necessarily always need as in-depth testing if there's really no other possible issue going on that you could to figure out. But the issue in this is that deciding, so in that example, is it worth doing all the testing if you just want a diagnosis? So if you're not planning to do any sort of different interventions based on what testing shows, you don't get as much out of the testing. If you use the testing results to help guide treatment, because even if someone already has a diagnosis of autism, how you may approach the treatment for them as an individual person is going to vary based on what other comorbid things there are.